change up the order of questions a little bit because the next two questions on bone marrow transplant is a little bit generic, and I think we can spend hours talking about it, and we at this moment don't have that time. We'll come back to it, but the next question that I'd like to go into is very specific and directed to Dr. Sriswana. It is that the patient is asking that I read that JAK inhibitors have an increased risk of blood clots. Can I still use this treatment if I have had a history of deep vein thrombosis or a blood clot in my legs?
Yeah, that's a very interesting question. And, caveat, I hesitate to answer if you as the patient should use this therapy, but I'm happy to give you my perspective on that question. Now, I come from a very biased point of view in that my diseases of myeloproliferative neoplasms have a very elevated and increased risk for thrombosis because of the disease. So actually giving a JAK inhibitor to these patients and controlling the disease lowers the risk for thrombosis across multiple of these diseases. So for that question, I don't think of an increased risk for DVTs from the therapy. I actually use the therapy to make the risk even better. I believe that this question is being stemmed from the JAK inhibitor use in autoimmune conditions, including dermatology, which is something I'm actually not very familiar with. And in my very brief literature review in the past 10 minutes, it seems that in the large systematic reviews of this potentially early signal of thrombosis in the JAK inhibitors actually did not pan out in very, very large systematic reviews. So if the question is about JAK inhibitors in autoimmune conditions, I hesitate to give an answer. But if the question is about JAK inhibitors for myeloproliferative neoplasms, I'm not really concerned about that. I actually use it to make the risk better. I hope that helps.
Great. Thank you for clarifying that really important point.